Good evening, everyone. We would like to thank you for joining us. My name is Tamara Sumler.
Hi, I'm Julie Iomay.
Thank you. We are members of Alpha Kappa Alpha Sorority Incorporated, Delta Beta Omega chapter here in Phoenix. And we serve as chairs of the Women's Healthcare and Wellness Committee, an international target of Alpha Kappa Alpha Sorority Incorporated. We would like to introduce Dr. Angela Allen, our presenter for this evening. Dr. Allen will be speaking to us about the All of Us research program. Dr. Allen holds a Doctor of Philosophy degree from Arizona State University, College of Nursing and Healthcare Innovation. She holds a Master of Education, Educational Specialist degree, a Master of Arts in Teaching, and a Bachelor of Science in Nursing. She is also a certified rehabilitation registered nurse with a specialization in research. Dr. Allen served as a research nurse at Banner Alzheimer Institute and Banner Sun Health Research Institute, a position that has culminated in her being the Clinical Research Program Director of Nursing Research. In addition, Dr. Allen served as the Clinical Research Program Director of Nursing Research for Banner University Medical Center here in Phoenix, Arizona. Dr. Allen currently holds a position as clinical professor at Arizona State University and is very present in the community, serving as an active member of the Black Nurses Association of Greater Phoenix area. She is a member of Delta Sigma Theta Sorority Incorporated, Phoenix Metropolitan Alumni Chapter, the Arizona Community Foundation, African American Women's Giving and Empowerment Circle, and the Black Philanthropy Initiative. She currently serves on several national boards, such as the National Black Nurses Association, the Association of Rehabilitation Nurses, and locally, the Tanner Community Development Corporation, and the Senior Leadership Council for Alzheimer's Association here in Phoenix, Arizona. Dr. Allen is currently employed at both Banner University Medical Center and Mayo Clinic here in Arizona. We are delighted to have Dr. Allen speak to us about the importance of health research and how we can participate to help shape the future of health among African American communities. Please join us in welcoming Dr. Angela Allen.
Thank you very much, Tamara, and I hope you can hear me.
Yes.
So thank you again, Tamara, Julie, and also the Sisters of Delta Beta Omega chapter of Alpha Kappa Alpha, excuse me. I should know that Sorority Incorporated. I want to again thank you for allowing me to present here before you. I will be enlightening you on COVID-19, the effects it has on the African American women, and also the All of Us research program. So if you go to the next slide. We know during these challenging times, we all want to do our part in spreading stopping the spread, of COVID-19. And I thought about this prior to presenting. Not only do we want to stop the spread of COVID-19, we want to stop the spread of cancer. We want to stop the spread of heart disease, which are actually things that we may have control over. We want to also stop the spread of diabetes and other things that are occurring throughout our country, and it has a large impact on African Americans and particularly African American women. Now, each of us, as you all know, we are unique. And that term unique, I like to say we are bio, psycho, social, cultural, and spiritual beings. That is one word. It's a word that I usually teach in my class where I teach at Arizona State University. And it is a term that identifies us as a unique being. But one of the things that many of us may not be aware of is that when we go to our doctor, when we go to our provider, our nurse practitioner, or whomever is being the person who's providing care for us, there is that one size fit all mentality. I say that because oftentimes when we walk into the clinic, many of you all may remember or recall, we still do the clipboards in the hospital and in the clinic. And some of the clinics are being a little fancy with the electronics, but you're still checking off those areas. Do you have the following? They do not change those documents. They do not adjust them for cultural aspects or any type of cultural diversity, it is still that one size fits fit all mindset. Well, one of the reasons, I know Tamara had introduced me and shared a lot of information about what I do, but I think one of the things that I'm extremely proud of, and I don't think that was shared, is that I am the co-chair for the All of Us board, basically, here in Arizona. And the reason for being in that position is to deliver and share the information that I'm going to be sharing with you today. Now, what you see in front of you, this slide, it says the All of Us research program is historic. This is something that we've been working on for over 10 years now. It's longitudinal, and longitudinal means there's long-term data that's being collected. So I'm gonna break some of this information down for some of you all. The purpose is an effort to collect data on over 1 million people in the United States. Now I know you're wondering, that should be easy, because we have well over that number. So we should not have a problem to collect data on over 1 million people. That's the first question you're probably asking. You're also looking at the fact that it's not throughout all other countries, it's only in the United States. And the reason for doing that is to speed up the process of research. And I know that's a stigma, particularly for the African-American population and also primarily for African-American women, because they're concerned with their children and their family. Some have said that I don't want to wipe out my whole family in research. Well, you're not. You're wiping out your whole family without research. So one of the things that our focus is on is precision medicine. Precision medicine is looking at you in a unique way, identifying you as that individual, as that biopsychosocial, cultural, spiritual being. Bio, because you are made up, all of us are made up differently. Even if we're looking at our particular culture, we are still made up different as African Americans. I can tell you, you could look at my family, my mother or whomever, and some people say, oh, this is how she's going to actually look years from now. Well, if you look at my mom and look at me, we totally look different in shape. When you look at my grandmother on my father's side and my father, that shape is what I've actually obtained. So again, that's that difference. There's the difference even in my own family. We are not all the same when it comes to bio. Psycho, basically mentally, we know that we have or may have some type of psychological concerns throughout our family, and I'll talk about that later, but we are all made up mentally different. And so when we look at biopsychosocial, social, the environment, even though I am directly from Michigan, my social environment has been changed within the last 15 years because of where I reside now. Biopsychosocial, cultural. Culture does not mean ethnicity. Culture is a term that is actually being used for anything, whether it's their spirituality, whether it's their ethnic background, etc. So we want to make sure that term is used appropriately. And then spiritual, and I added spiritual because when you look at most of the textbooks, they may not say that because the World Health Organization does not incorporate the word spiritual. But I say spiritual because we all know that we may come from different denominations. And when we come from different denominations, again, there's that difference in us. So again, not to go into detail on the one slide, but I want to just kind of give you an idea of why all of us exist. Now, all of us actually is funded. So this is actually an event that the federal government is actually supporting and actually supporting in a way to actually make sure that we're doing research. It is funded by what is called the National Institute of Health. And we're very familiar with that term now because of COVID. The National Institute of Health, CDC, World Health Organization is all giving information regarding COVID-19 and the impact it has on different communities, as well as medications and other things that we are taking, which are considered vaccinations. So it's important to know that obviously our federal government, our states, our local areas are actually people who believe in what we're doing as it relates to all of us. So again, that's very important. The other thing I want to share with you is that the National Institute of Health, as many of you all may know, they have over 27 different components, different centers. And so this particular program is under the umbrella of one area or one center. All of us is creating one of the largest biomedical databases ever. And it is so awesome, especially for my line of work. And I'll talk about that when we get to the next slide. So if you move on to the next slide. Before I get into the video, I want to just kind of share with you that this is actually giving you an overview of what All of Us does and how it impacts not only Arizona, not only African-American women, but our country. So let's go to this slide and then we'll move on to the next, or this video, and we'll move on to the next slides.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. Here, we are fearless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. We ask America to do, once again, what she has always done: lead the way forward. We're one nation, one people, but all of us are different. And it's those very differences that will lead to answers for generations to come.
Thank you so much. Thank you for also bringing me to the next slide. Before I go into this slide, which will be quite detailed, I don't know about you all, we are recording, and thank you again for recording this message. But I'm the type of person I like to take snapshots of certain slides, and the one in particular, that last one, when you noticed on the video, it actually shared with you to learn more about all of us, and you could have actually taken the picture. So just FYI, even after the presentation, feel comfortable reading about all of us. So the one area in that presentation, they said questions. And again, I've shared with you the goal. I've shared with you the purpose. The purpose is actually to identify over 1 million people, because I like to utilize the word over, not just 1 million, but over 1 million people to sign up for All of Us, so that they can be placed in a database, so that if certain studies are occurring, we do not have to research or recruit, if you will, individuals in the communities or throughout the country. We can actually go into this one database and give you a ring, determine whether you're interested in being involved in the study or not, and then move forward. And I love the fact that this program has identified such a high number. Speaking of numbers, I can tell you right now, unfortunately, and I'll be saying this towards the end, we are only at about almost 300,000. Yeah, that's true. We're only at about 300,000 in the country. And we're looking at meeting a goal of 1 million. And one of the reasons why I believe we are at 300,000, it could have been almost at 500,000 because of COVID. Here comes our antennas, here comes our concerns, and here comes the fact that we did not want to get involved in something because of the concerns that we had already as it related to an unexpected disease that impacted our whole country and other countries, if you will. The good news is that each state was tasked, and those who were participating, in actually recruiting people for the All of Us. And I am proud to say that Arizona is one of the leading states. We are currently at 40,000 people who have signed up for All of Us. So let me help answer some of the questions you may have about All of Us. And please forgive me. No, I'm not going to say forgive me. Please allow me to present why it's important to get involved in All of Us, including some of my personal stories and how this has impacted my family as it relates to diseases and medications and diagnoses, etc. So here are the questions all of us may help answer. How can we prevent chronic pain that affects more than over 100 million people across the United States? That's a question that many of us not only encountered ourselves, but may have our family members that have been impacted. Over almost $1 million a year is being spent on chronic pain. That chronic pain could be whether you're getting injections, whether you're getting certain type of medications, etc. This information has been provided in 2018 by the CDC. Now keep in mind, when we look at data, data is outdated when we are 2 to 3 years behind. So if it was almost 1 million people impacted by chronic pain during the 2008 year, just imagine 2021, that number has actually increased. They also found that women, older women, adults living in poverty or adults living without insurance were more likely to have chronic pain, but race was not directly impacted. So unfortunately, fortunately, I should say, because we do want to pinpoint African Americans, particularly women, when it comes to any of these diseases. Several studies state it had nothing to do with race, but more women were impacted by chronic pain. I'll tell you again, I want you to think of that question. The next question. We developed better treatment for diabetes, which affects almost 10% of Americans, or prevent diabetes altogether. Now, we all are very familiar with diabetes, and we're very familiar with the fact that diabetes has one of the #1 concerns, or I should say, leading causes of disabilities or death in the African American community. Many of us know that diabetes starts off, unfortunately, with a type 1, which could, again, you could be born with it, or a type 2, which a large percentage of the African American people have been impacted by that due to the fact of unhealthy eating habits, lack of exercise, and also having family history of diabetes. So again, having that said, you are actually looking at a large percentage of African American, and particularly women, who have diabetes. I've had a friend share with me, and this was years ago, but still, it just still sits in my head. Oh, I thought almost every African American person gets diabetes, especially if it runs in the family. No, that's not true. That again is called type 2. If you know better, you'll do better. So you change the way you eat, and you obviously increase your exercise so that you can prevent that opportunity of having diabetes. Again, that's a question I want you to think about. Or develop more cancer cures. This is what we want to do that will work the first time, so that we can skip painful trial and error chemotherapy. I don't know if you knew this, but cancer, especially breast cancer, has impacted African Americans for such a long time. And I can give a plug into CBBC, Coalition Against Blacks Against Breast Cancer, which is a large organization here in Arizona that needed to be developed because we found that more and more women, especially women of color, was impacted by breast cancer. And now we're developing a program called prostate cancer under the same umbrella. Well, the concern was the fact that many women, did not get detected, even if they did have insurance, because they had the concern with mammograms. Some have even said due to the radiation of the mammogram going through the skin may cause a breast cancer. Not true. So again, these are things that we have to think about, and why we as African American, particularly women, we're not getting involved. But this is what all of us will allow us to do, help us, if you will. Or develop better pain medications that are not as addictive. Remember a couple of years ago, they talk about opioid and the use of opioid. Obviously, opioids being used and people are actually overusing them, which causes an addiction. Typically, when a person is on an opioid or some type of narcotic medication, the physician or the provider will say upon discharge to take this for about 3 to 4 days and then start subsiding and going into a lower medication, maybe Tylenol, or maybe mixing it with one opioid med or narcotic with the Tylenol. And unfortunately, that wasn't occurring. So you have the increase of addiction. And I don't consider it my favorite, but my concern, this is what my background is in, Alzheimer's disease and related dementia, or slow or even stop the different kinds of dementia. Well, I can tell you, and I've shared this story with many people, that my grandmother was diagnosed with dementia back in 2005. And it was actually around that time her provider in Michigan stated that, oh, it's just because she's getting old. And I said, no, there's something wrong with her. And after trials and different things that I had to go through with some of the providers, I was eventually able to have one of the providers diagnosed with dementia, particularly Alzheimer's disease, and she was treated appropriately with the appropriate medication to allow her to actually live an additional 6 years. Again, no trials, No clinical trials for African Americans, just the fact that I knew that I could actually make a difference at that point. And then we also want to do what is really important, and that is, again, how can we help reduce health disparities in a way that is sustainable? What is health disparities? We also used to call it unequal treatment. The old term is unequal treatment, the new term is health disparities. Well, health disparities is a term that is used when a person of maybe not even color, but maybe not understanding obviously what goes on in medicine is treated in a different way that causes their disease or something that occurs with them to prolong the disease or cause possibly death. So what are these answers? What are the questions that are listed on this slide? Let me share this with you and I'll quickly end. There are two things. One, there's a new medication that Alzheimer's just came out with, and many of us are basically may have heard of it. On June the 7th, 2021, and I want to share with you that the last time they actually developed a medication for Alzheimer's disease was in 2003. The medication, I want to get it right, is called Aduhelm, Aduhelm. Now, last time they discovered a medication, again, was in 2003. Now they have a new medication that is for patients with Alzheimer's disease and related dementia that is even more effective. But the unfortunate thing that there were less than 5% of the people who were going through the clinical trials were African Americans. So where am I going with this? One more, and then I'm moving to my next slide. Many of you all remember lisinopril. Lisinopril is a blood pressure medication that was obviously something that was an ACE inhibitor. That ACE inhibitor was actually a very effective medication when it came to blood pressure. It dropped that blood pressure right down. It allowed an individual to take a lower dose, and it had less side effects. But for African Americans and others, I know, but predominantly African Americans, lisinopril caused the swelling in the throat. And you may have even seen this on some of the Facebook pages where there were people that were complaining of throat swelling, lips swelling, tongue swelling, and they couldn't swallow. And guess who they blamed? FDA, because they said they should have known better. And now we're looking at other medications such as ARCs, which are blood pressure medications. And those medications, many of you are made familiar with, losartan or Cozart, same name. Those medications are now given more to African Americans because they discovered after the people who were taking lisinopril, there were complications. It wasn't during clinical trials. It was during the real time when people were actually taking medications. What is this consistency that I'm sharing with you all on this slide? Is that if we don't get involved, we wouldn't know how to do what we need to do and what to take when we need to take it. Next slide, please. So, innovative, and we know the term innovative. I know it all too well because in all three areas in which I work, at Arizona State University is innovative. When we look at Banner, they're always looking at innovative ways to do things. And many of us know that Mayo is always involved in being innovative. So how is all of us being innovative? Well, we're looking at the large number of people that I just shared with you, over 1 million people. And we're not just looking at these people in Arizona. We're not just looking at these people in California. And I notice that because all the time when we look at research, we're looking at certain areas that actually have a more diverse population. We're looking in Michigan, where they have a large number of African Americans. And there are teams in Michigan that are doing the same thing we're doing here. We look at the diverse data types. So we're looking at clinical, environment, and also genetic and so on. And I'll be talking about that on the next slide. We're also focusing on participants as partners. So we're not just actually saying, hey, we want to get your information. We want, like AKA, we want you all to understand what all of us is about. We want you to walk away when someone says, what is all of us? And I've said this in the community, and I've heard several people say, I don't know. We want you to know what it's about, and we want you to join us, even encourage you to actually be a part of our board so that you can share with others. Let me share with you what all of us is about and how it's going to help not only us as a person and of color, but our country, so that we can find ways to help find cures for different things. We're also looking at a national open resource for all. We're looking at public and all the researchers. So myself as a researcher and other researchers throughout, I know there are a ton of male researchers that are involved in this, and other banners are also involved in this. So we're looking at other ways in which we can produce and also conduct some of the things that we're asking of. Now I'd like to get to the meat of the presentation. So let's go to the next slide. Why is diversity important in research? I don't think I need to share this with this group. I think I shared enough information on why diversity is important. I think it's important to know that even looking at this slide, our different backgrounds, as I shared with you, one size does not fit all. We also need to know that oftentimes we feel left out. Of course, Black Lives Matters. Black Lives Matters. Black Lives Matter. I have to say that several times. And the reason why, because it should matter even when we are involved in research. And I'll share with you that that research does not always include drawing blood. That'll be a slide that I'll talk about. It could be hearing our voice, hearing our voice. I'll repeat myself, hearing our voice. We want our voice to be heard. Did you know research also involves qualitative research? Qualitative research is when we have focus groups that get together to answer questions that others do not understand of us. That's research. It's not always getting blood or getting information that unfortunately we may feel uncomfortable with. That's what all of us is about. So that's important for us to hear that. Again, it's basically getting information from a diverse group of people. And no, I'm not going to pinpoint that all of us is just trying to get information from African Americans. 1 million people include diverse groups of individuals. You saw it on the video where there was various people that were identified. So again, all of us does not just include African Americans, but we are trying to encourage African Americans because we're not getting enough African Americans involved in clinical trials. And then also all of us, as you could see on this slide, it says 82% have been underrepresented in the medical research traditionally. And we know that 82% have been underrepresented. That's a large number. And that's the reason why we're underrepresented, because we matter, but we have to make us matter because we are not heard, but we have to share our voice in various ways. We also looked at 52% belong to racial, of the 82, 52% belong to racial ethnic groups that are underrepresented in also various areas. I'll quickly share with you that when we do research, particularly any research that I get involved in, whether it's Mayo, whether it's ASU, whether it's Banner, I always read the information and I'll share with you one moment. This is a consent sign that I don't even understand. So do you really think that the person who's going to read this understand it? Let's break it down so that they would understand it before we get them to sign anything. That's important. That's a voice that I'm trying to provide, a liaison, an advocate for people, not of just African American, but for any color and any age group and any intellectual area as well, because it's important that we want them to understand what it is that we're providing. Next slide, please. So here's the juicy slide. I just wanted to, it gives you a visual. So on this slide, I want you to understand the fact that we understand the whole person. That's a biopsychosocial, cultural, spiritual being. Again, the biopsychosocial, cultural, spiritual being. We understand basically the physical, we understand the mental, we understand your environment, we understand your race, we understand your religion, we understand your socioeconomic status, we understand your geographical location, we understand it. And that's one of the reasons why I love about all of us. So it not only looks at just one particular area, but look at these. I'm gonna grab one in each area, a couple actually. So when we look at environment, we understand that if you live in a certain zip code, that there may be some needs that you need, areas that you need, and we have to address those needs. But how could we address them if you're not getting involved in research? Research can simply be the fact that there's a low number of people that are not vaccinated in a certain area. And we discovered that the fact that those low number of people was not vaccinated because they couldn't get to a vaccination site. Let's look at air pollution. And I'm gonna pick on that one because I'm from Michigan. And I know that we are one of the highest populated or air polluted, environments because of our industry, automotive industry. We also found in Michigan that not only the fact that we have the highest number of people who have respiratory issues, yes, asthma, yes, issues where they could actually have SARS. The reason why, one of the reasons is because of the environment that is obviously surrounding the Michigan area. Did you also know that we had one of the largest number of people who died from COVID? Let's put one and one together. One, the fact that this is a highly populated area that's polluted, obviously having respiratory concerns. Two, we have a large percentage of African Americans. One and one makes two, and two is we had a high number of deaths. That's where I'm going with you guys. The point is of the matter is the fact that, let's say someone wanted to do a study in Michigan, and the study involved respiratory issues and pollution. And they asked a large percentage of the African Americans to get involved in the study. And the study involved a swab based on the fact that they needed your DNA. Or, I'm sorry, let's draw your blood so that we can see the blood level to determine if there's going to be some respiratory issues. And yes, by the way, they do draw blood to determine respiratory concerns. And let's say that the number of people of color chose not to participate. And let's say they have this medication that's going to help them. But unfortunately, because of the fact that we didn't have enough people in clinical trials, the medication, FDA, and we're familiar with that term, did not approve the medication. That's where I'm going with the All of Us research. The next one, and I'll go through them very quickly. We talk about the biological and clinical aspects. And when we talk about that, I don't need to pinpoint the one that I really love to focus on: medication. We talked about medication with lisinopril, ACE inhibitor, and our ARC medication, which is that Cozar. We're now finding more and more people are using Cozar and Larsentin. But the reason why they're using it, because they had to go through a real life issue of taking lisinopril with multiple complications. And there was a large percentage of African Americans who were taking ACE inhibitors. They also discovered that if you take an ACE inhibitor as a monotherapy, you'll have a greater chance of having side effects. Monotherapy meaning the pill by itself. But if you take the ACE inhibitor with another medication like hydrochlorothiazide, which we call water pills, you'll have a lesser chance of having side effects. We had to discover that in real time. Couldn't do clinical trials because we didn't have enough people. Let's go to the next one. Social environment, our upbringing, access to care. I don't need to go into that in detail because I just talked about COVID. The fact that people did not have access to care or access to even get vaccinated. How would we have known if no one ever got involved in clinical trials? And then the last one, behavioral, looking at activities of daily living, looking at smoking history and our eating habits. I just did a presentation back in November of 2020. And in the presentation, I presented to about 90 Caucasian, obviously there were some other medical providers, but most of them Caucasian. And I did a presentation on Alzheimer's disease in the African American community. And my presentation focused on the caregiver. And what I said, I want to make sure I have time. And what I said in the presentation, I said to the providers, I said, this caregiver who's an African American woman who lived in Atlanta, flew back home to visit her parents, only to discover that her mother had Alzheimer's disease and her dad chose not to tell her to protect her from actually going through, obviously coming there to take care of her, of her parents. And the reason why the father chose not to tell his daughter was because back at home in Atlanta, her daughter had just gotten COVID and her son was arrested, falsely accused because of some social issue, as we all know. True story. The father said, I didn't want to tell my daughter that my wife, her mother, was going through Alzheimer's disease. Now, when I presented this case to these physicians, the physicians said, oh, yeah, the daughter is going to be going through some serious caregiver burden. She's obviously going to have some depressed concerns. And I said, as a provider, what would you do for this daughter? Well, I would probably talk to her, maybe put her on some type of depressive medication. You heard what I just said? Now, at the end of the story, I gave them the outcome. The outcome was the daughter came here, she took care of her mother. Yeah, she actually visited her mother and father's church. She actually got consultation from the pastor of the church. She prayed about it. And actually this woman had a better score, a good score on her caregiver burden when we scored her. Because what she said was that my comfort was my mother and father's pastor, was my comfort was the fact that I came here to discover that my family needed my help. My son and my daughter were going to be okay, but I was able to provide the information for my parents to be cared for. And I was able to also utilize the resources back in Atlanta to help my son and daughter. Now, just imagine if she was involved in a focus group. Do you know just the data alone would allow those providers, when I did that presentation, to understand that there was no need for that daughter to have any type of antidepressants because they had a better understanding of that particular culture. This is what All of Us is about. Next slide, please. So what is the promise for participants? And I'll quickly go through this. It's a promise to fight disease, to improve health. It's a promise, a chance to learn more about our own health. I love this part because I'm part of all of us. I can tell you, I've done it, filled it out. Many of us do the genograms, and I actually have my colleague who's on the call, if she's still here. She does a wonderful job going through her family history to determine what issues that her family members have. Well, with all of us, we do that for you. We basically say, because you're giving us this information, we want to ask you questions and ask you to ask questions about your family members to determine if you are actually going to have certain things related to the diseases that your family members have. I'm blessed to tell you that I don't have hypertension in my family. I don't have cancer, knock on wood, in my family. We do not have diabetes in our family. But unfortunately, what we do have is Alzheimer's disease on both sides of my family. So when I went through that tree, I realized that my great-great-grandmother had some, what we call losing her mind or senility, or she just kind of going off her rockers, or she's just getting old. When we would discover it later, there was actually dementia, some form of dementia. So again, you could find this information out, access to your own data, ensure that your community is included in studies, and also understand new treatment like that Alzheimer's disease medication I just shared with you, learn about additional research opportunities, and meet others like you. Yes, there is a group of people who meet to talk about what they've learned about themselves and what other people can learn about, them as well. Next slide, please. This is me. I could share this with you. What is the promise for researchers? And I am a researcher in 3 different areas. I teach at the university research. I do research, and the director at Banner has been pointed out, and I'm now the research scientist for the community at Mayo Clinic. And so in this area, trust me, it gets to me that I need to keep promoting. I need to keep encouraging. I need to keep and convincing people of color. And I can tell you right now, I think it was shared that should we give incentives for people? And I said to this team, we can, but if people are going to sign up if they care, people are going to sign up if they choose to, they're not going to sign up just because you're giving them something. They're going to sign up because they believe in the mission. So I think the most important thing that I try to do is provide information so that you can either ask questions or you can actually provide information for others so that they would have a better understanding. It's an opportunity to save time and resources. Do you know, when I worked on my doctorate degree, some of my colleagues, I can tell you one of my colleagues who did a study on African Americans, and I forgot the details, but she says, Angela, I can't find one person to sign up for my study. She said, you live in Detroit, you're from Detroit, Michigan. I said, yeah. She said, can you help me recruit people in Michigan? I said, sure. Well, before I could actually go and recruit people, she decided to go to California, our neighboring state. And she actually stayed there for 6 months to do her study so that she can recruit more African Americans. I remember many of you all may remember a play that I actually was part of the persons who was instrumental in bringing the play here. It was at the Herberger Theater several years ago, about 4 or 5 years ago. And in the theater, in this play, there was a break, and then the break, we were to actually have some providers on stage to talk about African-American providers on stage, and actually not just African-American, but providers on stage to talk about different diseases, and one in particular was Alzheimer's disease. We were also supposed to have a person who was involved in clinical trials, a person of color, so they can talk about the clinical trials and how it has affected them and the great things that have occurred. Do you know the person that we chose was from Kansas? We flew her in so that she can sit on the stage to talk about how she's involved in clinical trials. Yeah, we looked all over, and you guys know, if you know me, I'm very resourceful, could not find one person. So that's how important this is. It's rich resource information. It allows me, when I begin to do studies, that I don't have to go recruit. I can call the number from the NIH and say, you've got the 1 million people. I need several people, need 30 people who fit this criteria to be involved in my study. May not even involve blood drawing or anything like that. I need to just ask them questions. So that's important. Also, a diverse cohort. I don't want to have 5% African American and then the other high percentage of the majority and maybe another small percent of Native American and then some Hispanics. I want it to be equally, we heard that word, equally diverse when I do research. Robust computing and analytic tools and secure data. We utilize secure data. I know I do, and almost all the studies I do, and the studies that I do not need secure data obviously is written inside the IRB. Engage participants. and people who believe in the mission and so on and so forth. We want to utilize this and we want to have those people in place already. Next slide, please, because I know I talk too much. Okay, so the providers are those I shared with you earlier. Those are physicians, those are nurse practitioners, those are physician assistants. Those are all the people that are considered providers. If I missed any, forgive me, that actually play a part in making sure that this information is there. Did you know that getting involved in all of us, and you know how sometimes you're saying, I need to get mama's records, or I need to get my records, I'm moving here, I'm moving there. This information is already put in a bank, and it actually can be transferred from one hospital, one clinic, wherever, just based on the fact that you're here. It's shared information only if you request it to be shared. So here's this information about you, your health history, your family's health history, under one roof, under one bank database, to be provided to that next person if need be. Next slide. Now, this is the slide that I really want to kind of provide a little bit more information, because you want to know, how can I be involved? So how can I be involved, and what are the potential activities as a participant if I choose to be involved, or if I choose to ask someone to participate? So I'll quickly go through these because they're right in your face. Obviously, we know due to research, we do not go over research and determine that we would actually ask anyone of a younger age, because anytime you ask anyone that's under 18 years of age, we have to get parental consent. So we knew that was too busy to do, so we chose to do 18 and over. With that, we're looking at obviously online consent. All of the information is actually on your phone. You can actually pull up all of us and actually sign up if you so choose to. We're also having answering surveys. So you'll be answering surveys, and it's very similar to what you do in the hospital or the clinic setting, or when you go to an outpatient doctor and you're actually getting that clipboard, and you have to come in 30 minutes early so that you can check off everything on the clipboard. Pretty much that's what this is. We're also asking that any additional information that you may have, think that maybe even your family member has not obviously been aware of, that you may have, or the fact that you're unique and unfortunately you have Crohn's disease, or you have something that obviously is not running in your family. So we'll be asking for that information. The other information we ask for is something that you do anyway. You give your blood pressure, you give your BMI, you check your heart rate, you check your height, we check your hip circumference, we check your waist circumference, and also your weight. Again, this is for, we don't know which study, because anyone can actually say, I need this information to meet the criteria of my study, and we are able to provide that information. Here's the kicker. This is the one that I think is important for many of us, especially those of color, because we know that unfortunately this is going to be that one that may not allow us to sign up. What do you need? Blood? Well, yeah, depending on the type of study. You know, they'll ask for blood, and if you notice in parentheses, if that's not feasible for you, then there's saliva, which actually we're very familiar with that now, taking saliva to determine the same information that you would do if you were actually retrieving blood. Urine specimen, obviously, to rule out certain things, and to determine even that can be detected if actually picking up information or picking up additional things in relationship to you or your family history. Also, bio samples can be also provided. So again, that we are asking for certain things in certain studies. In certain study, I want to emphasize that. And then we're also giving wearables and digital apps. And those are things that in some studies we will be asking you to participate in if you are eligible. Next slide, please. Excuse me, talking so fast and too much, I gotta actually take a break. So I'll quickly go through these. We are familiar, and this is where our numbers are kicking in, and I want you to hear this. You all know Dr. Corbett. Everybody knows Dr. Corbett. She's in the upper right-hand corner. Dr. Corbett is that African-American physician who actually just helped, scientists who helped discover Moderna. So I had to throw her up there. So because people say, you know, is African-Americans involved in research? Yes, this is one way. So 8,500 Arizona participants completed the COPE survey, and this is a new survey that actually obviously detects or give uptake on vaccines. So we are proud to share that information. It's obviously finding out what caused a person not to get the vaccine and various questions that we may need to further our research. We also look at, in this area, when it comes to COVID-related research, we have existing participants' stored samples were tested to determine how long COVID has been in the United States. So we were able to use some of that information. And this is actually me sharing information on those who already signed up for all of us, what we're doing with the data. Researchers were able to access biomedical, environmental, and lifestyle information on participants. De-identified meaning that we did not have their name exposed at all. We actually utilized a code, so therefore you weren't obviously identified, or the person wasn't identified, in order to talk about how COVID affects you and your family. And then in 2020, the All of Us administered 12,000 COVID antibody tests. We've also administered 7,000 PRC tests, as well as 80,000 rapid tests. Again, all under the All of Us. And then the U of A is also operating in the NIH Community Engagement Alliance, SEAL. And that's a program that I'm involved in. SEAL is Community Engagement Alliance League. And that's the program in which we are retrieving information from the community. We are looking at ways in which we can educate, make you aware of how COVID has impacted us, educate you, retrieve data to determine how can we help you, and how we can encourage you to take the vaccine, and what ways and what things are considered a myth as it relates to the vaccine. Next slide. How has COVID affected us, and particularly African-American women and those in this particular area? So COVID has affected us in many ways. African-American people make up about 13% of the country. We know it's about 5 to 6% in Arizona, but about 20% of those were caught with COVID, and 22% of them unfortunately died. I can quickly tell you that literally right before I got on this call, I just got a call from someone that I know, and they said, I share with you that I got COVID. So this has not gone away. They actually just called and said they got COVID, and they wanted me, as I've always done, to answer some questions to help them. And one of the things I said is to stay quarantined and contact individuals. So it's still here. Health disparities grow during COVID for communities of color, and we know that. So again, this is how it has affected us. And also chronic conditions which exacerbate the effects of COVID. Existed even a higher rate, not just respiratory issues, but cardiac issues. And also other issues such as diabetes and even cancer, because there's immunosuppressed areas of patients with cancer. Next slide, please. How has COVID-19 affected us disproportionately, particularly those of color? For those who live with extended family members, it can be very hard. And many of us have heard this from Dr. Fauci and others. When you have COVID, make sure that you stay in your room. Make sure you use a separate bathroom. Really? When we have family members who are living in the same house, who are sleeping in the same rooms, who only have one bathroom, we have to be mindful of that. And this how it has affected us. Many have shown, and people obviously have lost their jobs, and obviously many have shown that they are frontliners and people of color, those who obviously, when we say frontliners, working in a restaurant, nursing homes, those who are bus drivers, and those who work that because they have to work in communities, unfortunately, during the pandemic. Some may not have had health insurance, and we found that a large percentage of our people of color did not have health insurance during that time. When we heard about the GoFundMe during not only the fact that they died, but the fact that they have a high medical bill. Researchers are studying how factors like these can help have a better outcome. And that's why I said it's not just about the blood and the saliva, it's about asking you the question, how can we learn more about you? Remember that Alzheimer's story that I told you about the young lady who the doctor was thinking of putting her on an antidepressant when all he needed to know was, how do I actually address this person in a different way? That wasn't the one size fit all in that category. Next slide, please. What other health conditions are being researched under the All of Us data? Why maternal mortality rates is higher in African-American women? When we don't have enough women of African-Americans being involved in research, we will never be able to answer that question. Is the association of hypertension and stroke even higher in African-Americans? We keep saying that it is. We consider we're number one, but we will never be able to determine if it truly is if we're not involved in research, and how socioeconomic status affects the outcome of people with breast cancer. It does, trust me, as a member of the CBBC, I can tell you it does. Next slide, and I won't go into detail with this one, but I want you to just kind of look at it and just kind of hone into the highlights of how we're looking at some of these studies. This in particular is the one that I talked about, maternal mortality and morbidity in the United States, particularly with women of color. So again, you're looking at a study that has taken place. And again, this is recorded. You can take a picture. So you'll be able to see that there has been impact in relationship to this. Let's go to the next slide. Another study that has actually talked about GI disorders among Black and African Americans, again, patients. This is a study that was done by a team of individuals who were able to make determination or give outcome based on the fact that they were able to gather information. And then our last study, which is something we're very familiar with, and that is exploring stroke risk, if you go to the next slide, and also as it relates to race and ethnicity. Again, another study that was done at Cornell University, where we were able to identify whether there was an impact as it relates to stroke risk in other areas as it relates to ethnic and different populations. Next slide. So why join? I don't need to share this slide with you. I've already talked about why join. I'm not a salesperson because I don't choose to sell. I'm a person who believes in a mission of a program that has made a huge impact on people of color and other people. But unfortunately, it cannot continue if we don't have 1 million people in our country, if we don't have enough people of color to be involved. So this slide again, if you are interested to learn anything beyond what I've shared, I want you to actually contact myself, and that is going to be in the chat. If you have a question, please contact me. As I mentioned, I've been on the board for about 4 years now, and I'm the chairperson of the board. And so I know I have to believe in the mission, and I do it for a reason, because I've seen differences that have occurred throughout our country and also particularly throughout our state. Next slide. Now, this one I do want to share. Why is it important for African-American women to join? African-American people are more likely to have asthma, high blood pressure, diabetes, sickle cell, and also stroke. Unfortunately, we are #1 when it comes to those areas, and we don't need to be. There are ways in which we can address it. African-American women get breast cancer at the same rate as white women, but they are more likely to die. And I'm going to tell you why, because we actually get tested at a later date. We delay our tests because we're not aware of some of the things that we need to be aware of, or insurance concerns or other things that may take place. And then last but not least, researchers can look at our health and information and find out ways in which they can address. If it's not for you, it could be for your future family members. I often say that my grandmother had Alzheimer's disease, so I'm the researcher that's trying to find out how we can stop it. I may not ever get to me, but it may get to my family members, my younger nieces and nephews, so that I can address that. I want to be that next Dr. Corbett, right? Next slide. And this is a busy slide. It just pretty much talks about, we do have partners in our community, not just in our immediate community, but as you know, throughout our country. And as you all know, there are some that you may see, Morehouse, Emory, and others that you're familiar with. In the next slide. We also have partners throughout our network, our provider network, and you may see some of the sororities in different areas as well on these slides. So I just want to make sure that we don't work by ourselves. We actually have a team of people that support us. If you go to the last slide, and the last slide is basically questions. And so if we have any questions in these few minutes, because I know I talk a lot, please feel free to ask.
Thank you, Dr. Allen.
Yes, we do have one question, or I should say our first question. If there are any additional questions, please place them in the chat. Dr. Allen, our first question is, prior to the All of Us research program, what was the percentage of African Americans volunteering in research?
Prior to the All of Us research, there was less than 5% of African Americans. And so technically, think about it, there's still less than 5%. It's about 5%, maybe we've increased slightly, but that's why the All of Us exists, so that we can start. And I love the fact that AKA was able to, thank you, Julie, able to recognize that there was a need for this message to go out. And we're hoping to do even more, not only in our community, because I'm competitive. I want to be able to get a higher number than that. And I want it to be more of African Americans. So we still are at the same rate.
Okay.
We have a second question, Dr. Allen, and it is All of Us going to experiment on me in a clinical trial?
All of Us is not going to do anything to you if you do not wish for them to. So I'm a member of All of Us, and I could tell you, I have never gotten a call. I've not gotten a call, but if I do, I'll say, what's the study about? Tell me a little bit more. You want to know about Alzheimer's disease in my family? Sure. Drawing blood? Now this is me, I'm talking to my other person because I will get involved in blood. Drawing blood? No, I don't want to get involved. No problem, we'll call you if there's another study that is actually something you'd be interested in. Bingo, that's it.
Wow, okay, great, thank you.
And we have another question. If I decide to participate in the All of Us research program, how will you protect my privacy?
Your privacy is protected just as if you were participating in a local program. If you look at that one slide, and I know AK is going to send this out you'll see that it says that all of your information is confidential. It is in a database and no one can actually see that information. I'm part of the All of Us as a participant. And so one of the things we do, oh, I love this. I'm sorry, I got to say this. When you sign up, we'll show you where your information goes and how it actually goes into the system. And it's an NIH. And so that's where it stays. So again, it's not something that we could do anything with unless you allow us to do it. And I want you to remember, we haven't brought this up. Think of Tuskegee study. It was because IRB and this didn't occur then. Now we can say, I'll sue you if you utilize my information inappropriately. Then they couldn't because they didn't know better.
Right.
Yes, yes.
Great question. We do have someone in the chat who is interested in signing up for the All of Us program, and so we will connect her for that portion. But her question is, I recently signed up for the Tapestry study through Mayo Clinic. Is there any affiliation with the All of Us research program? And the second part of that, is there any counseling that happens, genetic counseling that happens if something is detected from the DNA mapping?
Okay, Tamara, you broke up on the first one, so I'm going to say All of Us is All of Us. It has nothing to do with Mayo. So Mayo has program, any of the research that you're involved in, if it doesn't have the umbrella All of Us and then the program, no, but that's a different.
Okay.
The second one you said was the second part of the
Is there any genetic counseling offered if there's anything found in DNA?
Yep.
Okay.
All of Us has everything. It's like everything under one umbrella. Oh, by the way, if you get involved in some studies, it's free because they're asking you questions. Like that genealogy tree. I hope my good friend, she's probably gone by now. It's put together for you.
Awesome. Well, I think the worry is that you undergo these studies and they find some kind of genetic abnormality. Will you just be left hanging? And so it's good to know that there will be some support after finding out those results so that you can, and then, make informed decisions and, spread that information with your family members and impact their health. So that was a very good question.
Yes.
So we've got another question, and it is it okay to send the link to All of Us to friends, family, and colleagues? Can we share this?
Now, I would be upset if you did that. No, so Julie and Tamara knows me and Carrie, those on the call. Not only do you send the link, but Tamara's put my email in there. I'm a talker. I believe in whatever I do. If you had a question, if you said, you know what, my family member, I had a reunion, somebody did a reunion and I was their presenter on Zoom for All of Us. Could you believe it? So if my family members had some questions, I'll be more than happy to address them. And Carrie knows that we have a team of people, we have staff that does this, but I like to do it on my own. Even as the chair of the board, I still like to do this on my own. So yes, be my guest.
Awesome. Awesome. I think, do we have any additional questions? And yes, we will put Dr. Angela Allen's email information in the chat. If you should have any additional questions, we would like to try to get a few more of them answered. So if there are any more questions, please put them in a few emails. I'm sorry, in the chat, and we'll take a few more questions.
And in the subject line, if you could put All of Us, because I get emails and I want to make sure that's what I'm addressing.
Wonderful. Well, Tamara, I don't see any more in the Q&A.
All right. Well, Dr. Allen, we would certainly like to thank you for the informative presentation. I think we can all agree that this was wonderful. We learned a lot. Some of us are inspired to participate, and you can see that we're eager to share the information. So everyone, please feel free to spread the link, spread the All of Us research program to your personal networks, to social media networks. The more that we can get involved, the better we can impact our own community. And I think that's the important message here is let's get involved and see some changes in our communities. So we want to thank you all. I'm currently multitasking. I'm putting Dr. Allen's email information in the chat for you all. So bear with us for a few minutes so that you can get that.
And then Carrie also put information, a phone number, if they needed to call a 1-877 number.
Got it. And that's in the chat, so please take a look at that. 1-877-268-2684. Tamara, I think we've covered everything. Dr. Allen, thank you so very much.
Thank you.
Yes, thank you. We appreciate you.
Appreciate you. Okay.
I think that's it. We thank you all for joining us, and we hope that you all have a good night. Please consider joining the All of Us research study. And on that note, join us again for our next presentation. Thank you.
Thank you.
Bye.
Good night. Bye-bye.